I want to introduce someone who I've gotten to know over the past couple months, starting with a virtual Consumer Electronics Show back in January. I got the chance to meet Mindy. So we'll bring on Mindy Grossman, the CEO of WW. For those who aren't familiar, Mindy was the CEO at HSNI Home Shopping Network, has had senior roles at Polo and Nike. Mindy, thanks for joining us today.
Always great to see you. Glad to be here. Sounds like a great event.
Yeah, no, it's been a great 3 days. And I think, on the first day, we did focus a lot around healthcare. We had Dr. Eric Topol. I interviewed Jim Swanson, the CIO of J&J. So
I saw that.
Excited to hear from you as you think about expanding what does WW mean and how you interact with the general population, not just about weight, but really about wellness. So let's start there. Obviously people are familiar with the brand Weight Watchers. You guys transitioned into really calling the company WW with more of a holistic focus on wellness. Why don't you talk a little about that transition, how that's going, and sort of why that switch?
Sure. Josh, I joined the company about 3.5 years ago to lead its transformation. And this is a brand that has been deeply impacting and transforming lives for almost 60 years through the power of the science behind healthy weight loss built on community. But the opportunity in today's world was so much greater to be able to democratize all the pillars of wellness and truly become people's partner in their ongoing journey to lead healthy lives. And today, to be able to marry technology plus meaning to help people live healthier, connected lives is more relevant than ever. So, fast forward after creating our impact manifesto around inspiring healthy habits for real life, people, families, communities, the world, for everyone, and be that brand that can democratize wellness using technology and data and personalization to truly give people access to all the elements of wellness, from nutrition, activity, mindset, motivation, sleep, hydration, all built on that power of community, content, and coaching, and relaunching the brand globally to have that consistent mark of wellness be known as WW. And so if you fast forward to today, we are the world's leading weight and wellness digital subscription platform with multiple member verticals and diverse revenue streams, all focused on giving people 24/7 access to the tools that they need, no matter where they are in their journey, to lead healthier lives. And given what we have all been through in the past year, the need for that, and certainly never abdicating our leadership that we have globally in healthy weight loss, because COVID has actually elevated that as a whole other pandemic, right, as we know, more so than ever. But to see the impact of what we can do both for individuals, for communities, and society as a whole, it's more important now than ever.
Right. So there's a whole bunch in there I want to get into. And first is this transition into digital and virtual, and how you engage with your community, your members. Historically, the company relied heavily on physical meetings, right? Bringing people together. Obviously, that connectivity and community you talked about, it's important sometimes when people are face-to-face supporting each other. How has the pandemic and sort of the inability to really bring together in a physical world, did that accelerate this transition into digital? It sounds like obviously the digital was on the roadmap. It was the plan already. But how, all of a sudden, right, all of the retail facilities are shut down, and the way you engage with your members and the way they engage with each other is through digital. How did that transform and accelerate the transformation of the business?
Well, it's definitely been an accelerant to what we were already investing in and focusing on, is to give our members, all our members, the optionality of what they wanted, whether it was an accountability or the experience that was going to work for them. So all of our almost 5 million members have our digital assets. But to your point, we had a portion of members who still wanted that face-to-face experience in person. And to give you a perspective, I started 2020 on the road on the WW Presents Oprah's 2020 Vision Tour. So 9 cities from January to the finale of May 7th, I was standing with 15 to 20,000 people, motivating them to live their best lives. Flew back to New York on March 8th. And by March 11th, we made the decision, for the safety and security of our employees and our members, to have to shut down our studios. And just to give you a perspective, we had 30,000 in-person workshops a week. Wow. Across all our countries. But it's really a testament to the strategy, the team, and the talent that in 6 days we were able to pivot. And we trained 15,000 coaches and guides and launched virtual workshops simultaneously in 12 different countries. And yes, safety and security was at the core of what we needed to do, but we didn't want to not have our communities stay together, because that's a core of who we are. And who's needed more inspiration and motivation and support more than in the past year? Right. And those virtual workshops continue to this day. To give you a perspective, in the United States, we operate virtual workshops 18 hours a day, 7 days a week. Now, the reality is that our digital business, our core platform, MyWW Plus, is 90% of our constituency. And that also includes a new experience that we launched in January called Digital 360, or D360. That's all about a whole new cohort of on-demand coaching, content, and community geared to a somewhat younger audience, but it's actually being embraced as a whole. But for those people that still want that direct coach accountability, we want to be able to do that. So that experience will always be a part of what we do, but that experience might be a workshop, or it might be a virtual event. So in addition to pivoting the workshops, in May of last year, we launched a global virtual event with Oprah that we offered free globally to everyone. And we've had unbelievable engagement. Actually, our next one is a week from Saturday. And they're all themed for what is relevant to what people are feeling today. And that's what we want to do. We want to be able to provide that support and give people the tools they need to live their healthiest life.
So when you think about, it's interesting, when I interviewed Jim Swanson from J&J, we talked about the explosion of telehealth, and not just telehealth, how physicians wanted to interface with their drug reps, and some of them were resistant to technology and telehealth. But now that they've experienced it over the past years, they look back and go, wow, why wasn't I doing this earlier? Do you expect, that segment of your population that you talk about that really was hungry and wanted to the in-person meetings to now embrace, sort of the e part of this, the digital part of this? Do you see that the behavior post-pandemic will now persist, or do you think certain behaviors will snap back to what they were pre-pandemic?
I don't believe there's such a thing as snap back. I think we've all been changed through this. I think we've all done, I used the expression before, what we've gone through of people doing a radical reappraisal of how they live, how they work, how they spend, what they value. And, health has really gone to the top of the pyramid of critical need, especially what we've all experienced. Now, having said that, I do think people are very comfortable really living, if you give them the engagement, right, in a digital environment or a virtual environment. But there are going to be those who just naturally want a combination of all of that. And so, our priority has been to meet members where they are and to really work to personalize whatever that experience is. So over the course of these last number of years, you brought up data before the start of this. We've invested significant resources in our data and technology teams, our AI capabilities. We now have tech hubs in New York, San Francisco, Toronto. And the idea is to motivate people to have even greater engagement, because the more engagement, the more personalized, whether you're talking to a one-on-one coach or whether you're just in the experience itself, or when you're with 600 other people in a motivating global virtual meeting, we want to know that you feel it's your WW. And I think that's what people want. What we're seeing right now, and you look at brands that are built on trust, brands that are built on community, and brands that can marry technology to meaning to give people a more purposeful relationship, are the ones that are going to come out of this as stronger businesses and brands, because people are going to want to be with them.
Yeah, and I think to your point, it's not a transactional relationship, right? It really is building the sense of community and engagement, and I think that's so important. We were going to get to this, but we had a question from Esther Dyson in the audience. We were going to get to this theme of, I was going to ask about inequality. We've talked a lot about the last couple of days about access to quality healthcare and wellness services. The question from Esther was just really trying to understand, are things like WW covered Medicare, Medicaid, commercial insurance? Are there parts of the population that are gaining access to your platforms? Maybe they can afford it or through other means.
Yeah. So, diversity and this idea of, truly democratizing wellness is at the core of who we are. And for me personally has been core to any culture and any company I've been part of. So in addition to our WW consumer business, we also have WW Health Solutions, which is our relationship with our providers, payers, physicians, and employers. And we've invested a lot in that over the course of these years, a whole new technology platform, our ability to have greater access. We recently announced partnerships with CVS Caremark, WellTalk, and other providers so we could give access, as well as a significant number of employers, and work as well with physicians. In addition to that, we launched WW Good, about 3, or not even years ago, because I really felt that we needed to do more to provide access to healthy eating and nutrition for underserved communities. So that's integrated into everything from our loyalty and Wellness Wins program. And just in a short period of time, we've already provided $5 million worth of healthy food to communities through our partners like Feeding America or Daily Harvest. In addition to that, last October, we led and launched the Healthy Living Coalition. We now have 26 private and public partners, everyone from Bank of America to JP Morgan to Chobani to Beyond Meat to Vitamin Shop, as well as our philanthropic partners like Feeding America. And our goal there is to focus on SDG 2, of the United Nations focus around good food for all. And the whole idea for us is that health and wellness should be a human right. And we have to come together, whether as business or society at large, and really focus on, advocacy, action, and investment to be able to help some of these problems. And actually, a lot of these problems not only were exacerbated, but really came front and forward in terms of the actual disparity between communities and access to healthy nutrition and to healthcare. So that's a big focus for us as well.
Great. And I know we have one other question from the audience, and I again say they're getting a little bit down in the weeds here, but as far as the payer provider relationship that WW has, do you, obviously we have people like Humana on our program later today. What is that relationship? Can providers prescribe a WW solution, and how do payers interface?
Yeah, well, ultimately, we're working very diligently to be a fulsome covered entity, especially in the areas where, we can be. We are today the #1 doctor recommended plan. And, but like everything else in our transformation, we had significant investment to be able to provide the greatest experience, the greatest dashboard. I use as a great example, we have a partnership with the city of New York. Actually, a white paper just came out on the impact of us being a covered entity through that, and just the impact we've been able to have on cost of care, absenteeism, and productivity. So that is a very big focus for us.
Right. And then just finally, you touched on this idea of data. We have Brett Greenstein from Cognizant a little later talking a lot about data. Anything that the data has told you as you now get more engagement from your community, anything you gleaned from the data that, maybe was an aha moment over the past year or made you think differently? How are you using it, and any insights that you could share that, maybe that data helped inform a different path or a different decision that you would have made otherwise?
Sure. We do, and we traditionally always did, but over the past year, we have been staying on the pulse of everything that's happening in consumer behavior. And if you can imagine, with the size of our member base, I can tell you on a day-to-day basis changes in what people are eating for breakfast, right? So you really saw different behaviors during different parts of this lockdown. Absolutely, behaviors around fitness and what people were doing. But psychologically, you saw definitely some different patterns. So the traditional pattern of everybody goes crazy, over the holidays, and then in January, there's this, big reset. What we're seeing now is that behavior is very personal, depending on where you are in the world and where you are in your life. And there were definitely times where people were like, yes, I know I have to take better care of myself, but I'm taking care of everybody else right now. I have to wait, and I'm going to do that. And, fortunately, I think people are starting to see some light ahead, even with the challenges that we still have in a lot of markets and a lot of communities. But I think we're going to see a different type of behavior cadence with people in what they need and when they need it. And that's why we have spent so much time and investment to be able to be there in a real personalized manner for when people are ready, which is what we're seeing now.
Yeah, I'd be even surprised, it'd be interesting to overlay the vaccine data with behaviors, right? I mean, I'm excited. I'm finally back in Manhattan. I'm taking the
Same.
going out to eat, I mean, those types of things obviously will change just based on the vaccine on an individual basis. So, well, Mindy, it's always great speaking with you. Thank you so much for all the great work WW is doing, and really appreciate you joining us today.
Well, thank you. Great to see you, and
Hopefully we'll
look
see you in
forward
person
to
sometime soon.
yes, soon. We're
Soon.
have dinner.
Yeah, no, that'd be great. Well, thank you again.